Welcome to Tell Our Stories. I'm Ryan McNamara. Today, I'm joined by Josh Wagoner, Divisional Director at Aviata Health Group and incoming President of the Florida Healthcare Association. Josh grew up running around nursing homes, but it took a detour through the hospital world for him to discover that long-term care was his calling. We sat down in Washington, D.C. last month to talk about the silver tsunami headed for America's nursing homes and why he believes the industry's future depends on standing together. All right, welcome to the Tell Our Stories podcast. I'm Ryan McNamara. I'm thrilled to be joined today by Josh Wagoner, incoming president of the Florida Healthcare Association. Josh, thanks so much for joining us today on the Tell Our Stories podcast.
Thanks for having me.
Great. So, Josh, why don't you just start us out by giving the listeners some perspective about your role and the work that you do. What made you get involved in senior care, and what was your first experience like working in long-term care?
So for me, it's a family thing. My grandfather, many years ago, served for the Florida Association of Homes and Services for the Aging, which is now Leading Age has kind of taken that mantle, another great association. And I kind of grew up running around assisted livings and nursing homes, independent care homes, and things of that nature. And, initially didn't want to do it. It was like, I did this. I don't know if I want to do this. Yeah. And I actually tried the hospital world, and I found it to be very political and very, who you know kind of stuff, and just a break from patient care and actually learning and the relationships you make in that field. And I was getting a little burnt out, and luckily met some people through my career already, and I got an opportunity to become an AIT, which is Administrator in Training. Mm-hmm. Had a great administrator training for a year. Mm-hmm. And just fell in love and was like, this is what I want to do. Yeah. And, meeting the families, meeting the residents and the patients, and just hearing their life stories and why they're here, and helping them, get back to where they want to be, or caring for them for the rest of their lives, mm-hmm. just became such a special thing for me. And it just has, driven me to just where I am now. Because I think you can't lose sight of that. You can't lose sight of what it's all about. And it's mm-hmm. about taking care of these people that we're just charged with caring for. And it's, it's a calling. So
that's really well put. I think everybody who works in long-term care has their own reason of why, and the mission is so important for us. And I think, especially in your state, in Florida, there are really strong demographic changes that are coming down the pike, and that are changing how we deliver senior care. And I want to put this in context for our listeners. We're here in Washington, D.C. this week for a part of congressional briefing through the American Healthcare Association, right, and the National Center for Assisted Living. And their congressional briefing is an opportunity for us to go to the Hill with providers, speak to them directly about the top issues facing providers across the country. And so in the context of that, what, you think about the message that you want to relay to policymakers this week, and what, if you had a couple of things that you could really leave them with, or key takeaways for them, what are the top, one or two things that you're thinking about in terms of leaving them with a message that resonates, in particular about either long-term care in general or in Florida more specifically?
So in general, and I can say this is nationwide, we're seeing a huge change in just the number of people that are coming to our centers. Mm-hmm. There's this silver tsunami, as we call it, that's just coming this way. And, especially in Florida, because we are one of the largest states that have, the skilled facilities and nursing homes. And it's, that's one of the biggest things. And so with that, we need more workforce. Yeah. And we need that support, and we need the funding to do so. And COVID had a drastic effect on our workforce. We lost people in droves, and we're just now getting back to pre-COVID levels of workforce. Mm-hmm. And so that's one of the biggest things. We're also seeing significant changes with the type of residents and patients we're getting. Behavioral challenges are one of the biggest things we're seeing, and it's, it's tough. We're the level of acuity we see now in our centers is not what we saw 5 years ago. It's not what we saw 2 years ago. This is not your grandma and grandpa's coming through the door anymore. It's not. We're seeing people as young as 40 years old. Wow. With mental health, behavioral issues, or just systemic, right, things that have happened to them. And we're taking care of those people, for a short period of time, or even for a very long period of time. And they're staying with us. And you have that dynamic of the 90-year-old, grandma who's, staying with us to her final days and taking care of her. And it's got a totally different, care perspective compared to the 45-year-old who needs help.
Yeah.
who just needs to feel and have a place that is secure and makes them feel just cared about and that someone actually cares.
Yeah.
So it's definitely a huge change in dynamic. And then of course, always the big thing that we're always asking for is funding.
Right.
Luckily in the state of Florida, we have a great Florida Healthcare Association is just fantastic, and they go to bat for us, and they've done great for us. But on a federal level, Medicare Advantage is something that we're always challenged with.
Yeah.
It kind of takes for traditional Medicare, we get to dictate the care, and we're making sure that we're giving the resident, the patient, what they need. Whereas we're kind of getting told, oh, well, they got to leave after 10 days, and you're like, okay, great. They probably need another 10 days,
right?
Or they're going to go back to the hospital. And when you lose that, when you lose to be able to the people that are actually touching the patient, the people that are actually caring for them, who have, who know what's going on, who know what this patient needs, and you're basing it on an algorithm that says, oh no, 10 days, they got to go. It's tough, and it makes our job that much harder. And then at the end of it, they're, I know we paid you for that patient stay, but we didn't really like it, so we're going to claw back some of that money. And it's like,
you're talking about the Medicare Advantage plans, right?
Correct.
And their relationship towards long-term care providers has been highly scrutinized.
Yeah.
For a number of providers are having issues with prior authorization, denies of care for seniors who need it.
Right.
And so this is an issue that we're really working on across the Hill this week and today specifically to convey to policymakers. It's a large challenge for providers that are just trying to deliver the highest standard of care possible.
Exactly, and it's all about quality. Like we want to give the best quality care. Like these people that come to us, like I said, we're charged with doing it, and oftentimes we're charged with doing it for less.
Yeah,
and it's tough, and it makes it really tough. But at the same time, we deliver. In Florida, we had a great Senate President, Senator Albritton, who really helped us develop a gold quality standard of care, and it incentivizes and rewards those that are doing it the right way. And and when you have a model like that is, you're incentivizing, but you're bringing it together and you're rewarding the people that are doing the things the right way. And instead of making it an adversarial relationship where, well, since you're not doing how I want it, we're just not going to cut you. And like, you're just creating an area that it doesn't work.
Right.
And you don't want that. We want everyone working together, going the same direction and trying to improve quality, trying to improve patient care, creating a space that where the residents can improve and go home, improve and go to their next place of care. And just become the best person of themselves and get them back to where they want to be.
And aligning those incentives is so critical.
It is.
And that's the goal that all these organizations are working towards ultimately. And, on the message or on the topic of workforce specifically, what would be your message to young people who may be considering working in long-term care, whether they're interested in working on the front lines, in a caregiving role, or as an administrator eventually, or working in policy and advocacy, broadly speaking? Do you have a message to young people who might be thinking about long-term care? You said initially, it wasn't your first choice in terms of your career, but now you've built a career out of it. And so what's your message to young people who might be interested in working in long-term care?
So we all, as an administrator, when I was kind of growing up and really, forming myself and building my teams, one of the things I always said to them when they joined was, when you come to work at these centers, you got to want it. This is not a career where you're just going to 9 to 5 and clock it out and get your paycheck and go. You have to be committed to this, and it's something. It will reward you in droves that you don't even realize. Like the people I've met, the families I've met, and the information I've been able to glean from them, the stories they have, they just fulfill your life. Like just for example, I had a gentleman a number of years back. He was actually from North Korea. Unfortunately, I can't remember his name, but he actually flew a North Korean fighter jet to South Korea, came to the U.S., defected, all that stuff, and he was in my nursing home. Wrote a book about it, and it's like, holy crap! Like you
heroes in your own communities, right?
You get to meet these people, and you don't get to do that. We actually get, for me, you get to touch these people. You get to really, really get to know them, and you get an investment into improving their quality of life, and that's what you want. And you want to build your team around that, and you get that opportunity when you join this. Like what's great about it is you can make your career out of this. Mm-hmm. And like I've had CNAs who have now become LPNs and RNs and directors of nursing. So I have a CNA that I remember working with way early in my career that I still talk to. Mm-hmm. He became we gave him an opportunity to center. He was an RN on the floor. Then he became the unit manager. Then he became assistant director of nursing.
Wow.
director of nursing. He's now a regional director of nursing for actually my company, which is great. And it kind of full circle, got to meet him again.
Great.
And it's fantastic. And he's loving life and having a blast. And he's just such a genuine person, cares about these residents, cares about these patients, loves what he does. And he's full of life. He's in his 30s and just, going from a young 20-year-old to where he is now and just doing great and just loves what he does.
Phenomenal. I think, in an era where AI is changing the workforce landscape so much and job opportunities are potentially harder to come by, long-term care is really a special opportunity for folks who are looking for in-demand careers where they're going to be able to make a difference and work in person, right? Yeah. And you talk about becoming a part of that community and a part of that family with the residents, and that's the overall goal, is to treat them like family.
Definitely.
I think it's an opportunity for young people who are looking at the career landscape and unsure about it to dive into a promising career path. And it sounds like training throughout that is going to be key in keeping those folks around, but lots of opportunities in our sector.
Definitely. And, in Florida, we have with FHCA, we actually have a great opportunity right now. We have, we created a kind of a scholarship fund for those that want to improve. And we have a couple different scholarships. We have a scholarship that helps people that are becoming brand new administrators, and they get a scholarship that helps them pay for their licensing test and their training. We have ones that a career climb scholarship that allows those that are working that are, want to be a CDM, so they're a dietary aide and they get to apply for the scholarship and get their CDM license. We have one that's a one for nurses specifically where they're a CNA, if they're an LPN and they just want to do more and grow.
Yeah.
And we can do it with our own association. It's all by donation and it's fantastic, and we do fundraising for it. And it's just a neat little thing. And we have some ideas coming for the future that hopefully, with my career as becoming president of the association, that we're looking at expanding the workforce and how do we build our, the next round of leaders that are coming through, whether it's starting at a CNA level or the nurses or even administrators, and training them specialized into, it's so much in the college career, it's focused on the hospital and the hospital system. And can we create a long-term care track that whether if they want to work in nursing centers, or if they want to work in ALFs, or if they want to do hospice even, here's the things that we're focusing on. Here's the things you should be looking at and how to train them and why we do this and the specialization of that.
That's so phenomenal that you guys have programs built out to help support those caregivers, because we know it can be cost prohibitive for some folks to enter the healthcare workforce if they don't have those supports. And so here at Tell Our Stories and at Direct Supply more broadly, we're always looking for ways to support those initiatives. And we'd urge policymakers in other states, beyond Florida, to consider replicating some of the success you all have had in those programs. I think that makes a lot of sense.
It does. I'm very proud of Florida leads the way in a lot of things.
Yeah.
I feel like we're probably one of the best in quality. But also just, anything we can do that we can help out any other state, we're always willing to do so. And but we'd love to be number one in a lot of things, of course. But the great state of Florida. So
Sunshine State. Well, and in closing here, I think we're going to wrap up, but just if you could leave our audience with one or two things that are giving you optimism when you think about the future for long-term care and what's coming down the pike and what the industry has in store. What leaves you with optimism? What gives you hope, or that you're hopeful about as we go forward?
What's great is it's coming to these events oftentimes, when you get around people from around the country and everyone has the same mindset, the same goal, and they want to do, everyone has this want and this internal need to improve and give the best care and give the best quality to the people we take care of. And my buddy Luke over there is going to talk about our treasured elders, and they're the treasure that we have, that the ones that lit the way, that they're the shoulders we stand on.
Right.
And so it's when you see the buy-in from everyone, it's huge and explodes, and it kind of rejuvenates you. We actually recently had a thing in the state where People Worth Caring About, which is a docuseries, and Kristen, who's with us from Florida Healthcare Association, got to follow around that group, and just she was able to go to those centers and see what they do every day and see the care that's provided, and how much people put into it and how much of themselves, and the 1,000% they give every day. And it kind of rejuvenates you. And it just shows you there are people out here who want to do this, who are willing to just put all of themselves into it. And it gives me just so much great hope in what's going to happen with us. And, when we stand together, our voice is loud and proud and very, we're forceful, and we can make the changes and get the people to see why it's so important. Because we don't want to go back to those days where getting old meant, living on the streets.
Yeah.
We don't want that to happen. And so, we want to make sure that we build a better future for not only those that are coming behind, but those that we have there now.
That's really well put, Josh. I appreciate you spending the time with us today on the Tell Our Stories podcast. And
Thanks
I
for
think
having me.
no better way to leave it than how you just put it there. So thank you so much, and we look forward to seeing all the work you and your team will accomplish in Florida.
Thank you so much.
Great
Time.
That was Josh Wagoner, incoming president of the Florida Healthcare Association and divisional director at Aviata Health Group, reminding us that when providers stand together, their voice is powerful. Because behind every statistic is a story, and every story is a call to action. This is Tell Our Stories. To listen, visit tellourstories.com or wherever you get your podcasts.